The question is about the cost-sharing opportunities, and will that drive up the costs?
That's what I'm not able to comment on.
Okay. Let me then move to, will you uphold the laws of the land, even those that you oppose?
That's my sworn oath, yes.
Okay. Does that include enforcing the individual mandate? Yes or no? Yes or no?
So long as the law is on the books, we at the department are obliged to uphold the law.
Are you aware of the cost of not enforcing the individual mandate? CBO estimated in December that without the mandate, premiums would jump by 20%. Will you work to avoid such premium hikes by enforcing the current law?
I think CBO has been, it puts a whole lot of stock in the individual mandate, and we would suggest that the proof isn't there to suggest that the individual
Will
mandate
you work
actually
to avoid such
the
premium
kind of
hikes by
coverage
enforcing the current law?
I beg your pardon?
Will you work to avoid premium hikes, as has been projected by CBO, by enforcing the current law?
Well,
yes or no?
Remember, I would suggest to you that the current law is increasing premiums, and what we're trying to do, what the commitment of the administration is to make certain that every single American has access to affordable coverage.
The Office of the Inspector General is investigating HHS's halting of advertising during open enrollment in January. Do you intend to halt advertising again this year? Yes or no?
I haven't had any discussions about that. That was done prior to my arrival.
Will you maintain or expand the level of funding and activity provided during the 2017 open enrollment?
What we're committed to is making certain that the American people have access to affordable coverage.
Will you maintain or expand the funding for the Marketplace Call Center, Data Services Hub, and Navigators? Yes or no?
Those questions actually depend on the outcome of this process, where this is the first step in the appropriations process. So we'll see what research.
No, there's a judgment call about whether or not this is, I don't know where the decision was made to cut off the advertising during the open enrollment period in January, but that cut off people's information about whether or not they should enroll or not. So will you continue that effort to disallow advertising to let people know about enrollment?
Yeah, that happened before my arrival.
Well, but what will you do?
Well, as I said, we're committed to making certain that every American has access to affordable coverage.
So you will continue to do the advertising. You will do advertising.
We're committed to making certain that the American
You'll
people
do
have access to
advertising.
coverage. I wouldn't commit to any specific entity because many of these things.
That's what we're concerned about,
Mr.
That's what we're concerned about, Mr. Secretary.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.